Restylane is the #1 selling dermal filler in the world and has been used in over 1.4 million treatments in the U.S. alone. It is the world's most studied cosmetic dermal filler. The Restylane family of products includes Restylane and Perlane. Both are cosmetic dermal fillers that replace lost volume and restore youthful contours to the skin to smooth away moderate to severe facial wrinkles and folds, such as the lines from your nose to the corners of your mouth. These products are proven to deliver long-lasting results due to a patented stabilization technology. Restylane lasts about 6 months. Perlane lasts at least 6 months in a majority of patients. If you're considering facial wrinkle correction, there are a few things you should know about Restylane and Perlane. These products do not use animals as their source of hyaluronic acid. Instead, Restylane and Perlane use a biotechnical process of bacterial fermentation as their source of hyaluronic acid. This limits any risk of animal-based disease transmission or allergic reactions. Restylane and Perlane are biocompatible with the body's own natural hyaluronic acid, and no allergy testing is required. You don't have to choose between Restylane and Perlane. Both products were used safely in opposite sides of the face by the same patients during a clinical trial. They contain identical molecules made by the same biotechnical process and differ only in gel particle size. Perlane gel particles are larger and designed for deeper injection than Restylane. Your doctor will decide which product is right for you based on an evaluation of your facial wrinkles or folds. Young skin is smooth and elastic and contains a lot of hyaluronic acid, which is found in all living organisms. Naturally occurring hyaluronic acid binds water to give volume to the skin, shape to the eyes, and a lubricant to joints. However, as the amount of hyaluronic acid decreases with age, less water is bound, and the less fluid in the skin, the less elasticity. In time, this may create wrinkles. Restylane and Perlane injections can be completed right in your doctor's office. Results are practically instantaneous. You can return to work and normal activities with little or no downtime. There is no allergy testing required, so you may be treated right away after consulting with your doctor. If you are planning to attend a major event such as a wedding or reunion, we suggest you have your treatment at least 10 days prior to the event. The week before your treatment, you may be asked to avoid certain products that promote swelling and bleeding, such as aspirin, non-steroidal anti-inflammatory medications, St. John's wort, or high doses of vitamin E supplements. Also, if you have previously suffered from facial cold sores, discuss this with your doctor, who may prescribe a medication to minimize recurrence. Follow your doctor's specific instructions. Restylane products are injected directly into the skin in small amounts by an ultrafine needle. As with all injections, some patients may experience discomfort. To increase your comfort, your doctor will assess your need for pain management and determine what technique is right for you. Before treatment, the area should be thoroughly cleaned with alcohol or some other appropriate antiseptic. The crystal clear gel is injected into the skin below a wrinkle with an ultrafine needle. Multiple injections may be required. When the injection is completed, the treated area may be massaged so that it blends smoothly with surrounding tissues. The number of syringes you need will depend on the depth of the wrinkle or fold and other considerations. To give you a better idea of what may be required, look at these patients and see if you can find wrinkles like yours. In each case, you can see how effective one or more syringes were. This woman had the lines from her nose to the corners of her mouth, known as nasolabial folds, corrected with Restylane. This was how she looked before Restylane. This is how she looked after. This woman also had her nasolabial folds corrected with Restylane. This was how she looked before. Here are her results. This woman had her nasolabial folds corrected with Perlane. This was how she looked before treatment. This is how she looked after Perlane treatment. Restylane.